Today in this lecture, we are going to discuss the role of angiotensin 2 in the tubular reabsorption. And we are discussing the formation of a urine. We have so far discussed different steps of a urine formation, and one of the most important step is tubular reabsorption. The process through which different substances are absorbed from these tubules in the nephron into the blood vessels. So we have discussed the importance of different hormones like aldosterone, and we have also discussed the different conditions in which there is increase or decrease in these hormone levels, and how these levels affect the tubular reabsorption process. So today we will discuss angiotensin 2, the role of angiotensin 2 in tubular reabsorption and urine formation. First of all, we have previously discussed how angiotensin 2 is released. Whenever there is a decreased arterial pressure, there is a release of renin, and renin converts angiotensinogen into angiotensin 1, and then this angiotensin 1 is converted with the help of angiotensin converting enzyme ACE into the angiotensin 2. And then the role of angiotensin 2 comes in the reabsorption process, which ultimately helps in the control of arterial pressure as well. So angiotensin 2 plays its role through the salt and water retention and vasoconstriction, but we are going to focus on this salt and water retention. How angiotensin 2 helps in the retention of salt, in the retention of sodium. So there are a few factors, or there are few ways through which the angiotensin angiotensin 2 acts. Angiotensin 2 first of all stimulates aldosterone. Angiotensin 2 stimulates aldosterone, and in our previous lectures we have discussed that aldosterone acts on the principal cells of the cortical collecting tubule here. Aldosterone acts here, and it helps in the reabsorption of sodium from these tubules into the blood vessels which are present in this area around these tubules. So one role of angiotensin 2 is to secrete aldosterone. Aldosterone is secreted from the adrenal glands, and then aldosterone comes and acts on the principal cells in the cortical collecting tubules in this area and helps in the reabsorption of sodium. So that's the first function of angiotensin 2. Another important role of angiotensin 2 is the constriction of efferent arteriole. So here we have the afferent arteriole, here we have the efferent arteriole. When the angiotensin 2 acts on the efferent arteriole, these arterioles gets constricted, and due to the constriction of these efferent arteriole, the peritubular capillary hydrostatic pressure, the capillaries which are present in these areas around these tubules, which are known as peritubular capillaries, the hydrostatic pressure in these capillaries decreases due to constriction of the efferent arterioles, and due to the decrease in hydrostatic pressure of the peritubular capillaries, sodium starts moving from the tubules into the capillaries. So this is another way through which angiotensin 2 is helping in the reabsorption of sodium and tubular reabsorption, and ultimately formation of urine. When angiotensin 2 causes constriction of the efferent arteriole, not only will it decrease the hydrostatic pressure in the peritubular capillaries, but it will also decrease the it will also increase the filtration fraction. It will increase the filtration fraction in this area. Filtration fraction is the amount of fluid that is filtered. So if there is a constriction, the pressure in this area increases, and a lot of fluid get filtered into the glomerulus. Now this is one thing which we have discussed previously, that this is the role of the nephron is that fluid gets filtered, and then that fluid keeps on moving. Some of the electrolytes are absorbed, some of the substances are secreted, and at the end urine formation occurs. But this process is dependent on a lot of factors, including the increase or decrease in fluid volumes, or increase and decrease in the blood pressure. So when angiotensin 2 constrict this area, the filtration fraction increases. When the filtration fraction increases, the amount of protein, the colloid osmotic pressure in the peritubular capillaries increases. And when the colloid osmotic pressure in the peritubular capillaries, the capillaries which are present here in these areas, when it increases, it also helps in the reabsorption of sodium. So due to increased loss of fluid, concentration of proteins in the blood vessels occur, and there is concentration of proteins in those blood vessels as well, which are present in the peritubular area known as the peritubular capillaries. So that is the increase in colloidal osmotic pressure, and that increase in colloidal osmotic pressure helps in the reabsorption of sodium. So that is another function of the angiotensin 2. Finally, angiotensin 2 directly stimulates the reabsorption of sodium from the proximal convoluted tubule and the distal convoluted tubules, and that action is achieved by two ways as well. One is the activation of sodium potassium pump, and the other is activation of sodium hydrogen pump. So you see, here we have the basolateral membrane. Here we have the sodium potassium pump. So this pump is activated and sodium reabsorption occur into the blood vessels. These are the peritubular capillaries. So angiotensin 2 directly will stimulate the sodium potassium pump in the basolateral area, and it will also stimulate sodium hydrogen pump, which will which will pull the sodium into the cells, and then this pump will throw out the sodium out of the cell. So by activating sodium potassium hydrogen pump in the luminal membrane, and by activating the sodium potassium pump in the basolateral membrane, angiotensin 2 is again helping in the reabsorption of sodium. So angiotensin 2 helps in the reabsorption of sodium by stimulating aldosterone, and then aldosterone acts on the cortical collecting tubule. Then angiotensin 2 causes constriction of the efferent arteriole, and due to which there is increased reabsorption of sodium in the peritubular capillaries through two ways. One is the increase in the colloidal osmotic pressure, and the other is the decrease in flow. When the decreased flow occurs, the decreased hydrostatic pressure occurs. Pressure in this tubule is high, and pressure in the vessels around this area is low. So high pressure will push sodium towards the low pressure area. And finally, angiotensin 2 will directly stimulate the reabsorption of sodium in the proximal and distal convoluted tubules by two ways: by activating the sodium potassium pump on the basolateral area, and by stimulating the sodium hydrogen pump on the luminal side. So that's the role of angiotensin 2 in the reabsorption of sodium, and that's the role of angiotensin 2 in increasing the amount of fluid reabsorption, which ultimately may help in the increasing the arterial pressure if the blood pressure has decreased, or it may also helps in the changing the urine formation process. So the release of this hormone is dependent on the increase or decrease in arterial pressure, and only then it comes into action. But once it comes into action, it has a lot of ways to increase the reabsorption of sodium. That's all about the role of angiotensin 2. Thanks a lot for watching the video.